So welcome everyone. Thanks for joining us this afternoon. We're super excited about getting started, and we have a lot of really good information to pass out this afternoon. So my name is Kay Huff, and I will be your Benco host for this afternoon. And what I want to do before we get started is just kind of go over the CE guidelines to make sure that everyone understands them. I'm just going to wait a little bit longer while the numbers are still going up to make sure everyone gets on. So if you have a question, someone's already raised their hand. If you have a question, if you will just put that question in the Q&A box, I'm sure Alyssa will help you in the background. I see that someone already has their hand up. So please just put your answer in, your question in the Q&A box at the bottom, and we'll make sure we help you. So with that being said, I'd like to get started. Number one, thank you so much for joining us this afternoon. We really do appreciate your time. And we want to make sure that you know tonight you will receive a 1-hour CE for this course. It's really important that when you register, though, that you make sure that you registered in your legal name. And by that, I mean what is on your license. So if your bill and on your license is Williams, you need to let us know so that we can make that correction. Each person that registered that would like to get a CE, please make sure that you log in on your own device. What we do when we do the webinars is the way that we see that you're on is that you're logged in. So it's going to be very important that you log in on your own device. Also, if you're calling in on a cell phone, and as long as you push the link and you're watching with us and you can see it, you're in good shape. However, if you're listening on your telephone, all we will see is your telephone number. So in order to be able to give you the CEs for tonight's course, what we're going to need you to do is to send your name, the title of the course, and your telephone number that you're dialing in on, to email that to practicecoaching@benco.com. Again, that's only if you're dialing in. If you're dialing in, please send me your name, the title of the course, and your telephone number to practicecoaching@benco.com, and we'll make sure that we cross-reference it so you'll receive your CE. Also, you will be receiving a survey. Please make sure you give us some feedback. Let us know what you need to hear. We want your feedback. And so please give us some feedback and let us know what you want to hear more of. Also, on the very bottom, you're going to see the Q&A. We definitely want to answer your questions. So we will be answering all the questions towards the end of the webinar. So all you have to do is type in your question and we'll make sure that gets answered. If for some reason we cannot get to all of the Q&A live, what we will do is we will have the doctor respond afterwards, and everyone that's on tonight's webinar will receive a copy of the Q&A so that you'll have it for your records. So I think I went over everything. Super excited. I love this is my next part. Of course, everyone knows that. So I would like to introduce the most amazing person that you ever would know in the dental field, who probably knows more about everything than I can possibly think of. The managing director of Benco Dental, Chuck Cohen.
Okay, the introduction just get better and better every time, so thank you. Good to see you too. Tonight's a very special night. We've got a really great speaker. She happens to be a friend and a well-known practicing dentist. To read her CV would be to go on forever. She's a graduate of Ohio State Dental School, as I think every dentist in Ohio is, at least everyone that I've met. She owns her own practice where she practices with her son in Columbus, Ohio. She is a member of many organizations. She's the immediate past president of the Ohio State Dental Association, so the ODA. She took over that organization in a very difficult and challenging time through the COVID thing, and she's done an excellent job. She's here this evening because she has a personal experience with opioid addiction. Her son, Sean, tragically died of an opioid overdose in 2015. And she and I met not long after that, and I remember speaking with her about it. It was quite an experience, and she's going to share that a little bit tonight and talk to us a little bit more about opioids in dentistry. She does have a son, Michael, that she practices with, so she has a family business, and she's going to be talking about her own experience with opioid addiction. So, Dr. Parsons, thank you for being here this evening. Proud to introduce you, proud to call you a Benco booster and a Benco customer, and we much appreciate your being here and sharing your story.
Thank you, Chuck. Hi, as he said, I'm Dr. Sharon Parsons, and we're going to be talking about opiates, dentistry, and addiction. So Chuck did such a nice introduction of me. I want to introduce someone. This is Sean Herman. This is my older son. Sean was a really bright young man. He played sports. He was a catcher on his baseball team in high school. Started at OSU in the scholars program. Loved to read. Was a nut about political science. So, you know, the fact that he's not here, I can't even imagine. So as I talk to you tonight, I'm going to give you a lot of facts, but I'm also going to interweave with it my story and Sean's story and how this can happen and how we as dentists can tie into this. So I'm going to give you a little bit of background about addiction first. So major growth occurs in your prefrontal cortex between the ages of 13 and 26. So if in that little sweet spot of an age, you are exposed to an opioid, you have 5 times better chance of becoming addicted. And that's huge. I mean, think about that. 5 times. So that means, let's see, middle school, high school, college sports, and that also means wisdom teeth. And of all the people with addiction, 96.5% started substance use before the age of 21, in that sweet spot of an age. And genetics account for 40 to 70% of the risk. I mean, if you notice, alcoholism will tend to run in families. Addiction of any kind tends to run in a family. So you as a practicing dentist, I mean, can you look at one of your patients and say, you know what, Jimmy's okay, but golly, I got to watch out for that Mary. You know, I'm not that good. I can't look at someone and be able to tell. So I think we have to approach all of our patients the same way until, you know, we either have a genetic way of knowing or, you know, something else happens. So when I was in dental school back in the dark ages, we were told that we were responsible for managing a patient's pain. That, you know, not that we left everyone in pain, but that, you know, patients would have a small amount of pain and you needed to educate your patient on what that would feel like, how it would be, how the pain helped us, you know, the type of pain to tell what was going on with them. Then later on in the 90s, all of a sudden the pendulum swung and people were told, and people were taught in school that you were to eliminate pain. And along with that, there some new drugs came on the market, like OxyContin. And at the same time, pain was named as a vital sign. So it was almost like a perfect storm. And if any of you have read the book by Sam Quinones, Dreamland, it's an amazing book, and it explains how this whole thing happened. But in it, he talks about OxyContin. So OxyContin came on the scene in the mid to the late 90s. And one of the things that they said was that you had less than a 1% chance of addiction, which, as we all know now, was totally not true. Now, what they did was took a study that was done in a hospital. So in this study that they would share, they were talking about someone who had an operation who was given OxyContin IV under strict conditions for no more than a day or so. None of them ended up being addicted. That was the study, but they kind of twisted it to go in their favor. And I have a friend who's an oral surgeon about my age who told me that, that at that point in time, most of the reps for the drug companies were either retired physicians or pharmacists, and that you could always trust them when a new drug came out to tell you about it, to let you know how everything was. And they said that Purdue Pharma, who makes OxyContin, developed a whole new way of selling, that their sales reps were not pharmacists, they were not physicians, they were very attractive females who knew very little other than what they were told to say. So as you know, all of this started, and people were, they would give medical doctors, oral surgeons, plenty of samples, and they were encouraged to prescribe this for patients. So, this all played in to how all of this came about. So, is drug addiction a disease, or is it a moral failing? Because I know that when my son became addicted, a lot of people looked down on him. And, in the beginning, I wasn't real sure about it. We were always told that it was those people. In my son's case, how it happened, and I don't want to paint the picture that he was always an angel. He was not an angel. He was a normal kid. He did all the things that kids would do. He snuck beer in high school. I'm sure he smoked pot in high school, and partied in college. So he was a normal kid who tried to get away with stuff, but wasn't off the top. But in his third year of undergrad at OSU, I started to notice that that he was about a half a beat behind, and I'd ask him, what's going on? What are you tired? Yeah, Mom, I'm really tired. I was studying last night, or there was always a reason. He always had an excuse, and then it got worse and worse and worse. And finally, he admitted that he was addicted to OxyContin, and it came out that how it started. He had called me and said he wanted to go dirt bike riding with a friend, and it was during finals. And I thought, as a mom, that's the dumbest thing in the world. You can't do that. You're going to fall. You're going to hurt yourself. You're not going to be able to take your finals. Absolutely don't do it. Well, being a 21-year-old kid, of course he's going to do it. So he fell. He hurt himself, just like Mom said, and he didn't want me to know. So he didn't go to the urgent care. He didn't go to the ER. There was a guy living in the house next to him off campus, and he handed him 4 pills. And he said, this will get you through for the next couple days. And apparently it did. And apparently he liked it. And he went back for more. And that was the start of a horrible, horrible odyssey that ruined and ended his life. But it started with 4 pills. And remember, he was 21. He was in that age range between 13 and 26. So is drug addiction a disease, or is it a moral failing? Well, if you look at the disease, what makes something a disease, let's compare diabetes and addiction. Type 2 diabetes, there's a genetic predisposition. Same with addiction. There's an organ involved. In diabetes, it's the pancreas. In addiction, it's the midbrain. Diabetes has too much glucose, not enough insulin. Addiction, too much dopamine. So the result, tissue receptor downregulation, and in addiction, receptor downregulation in the brain. The effect, glycemic instability versus depression and craving. So it has been proven that addiction is a disease. And I think as medical professionals, as dental professionals, we need to look at it this way. And we need to understand how easily it can happen and how by our prescribing even a small amount, we may be leading someone to addiction. We may be their first taste of that, especially if they have a genetic predisposition. So as a dentist, am I part of the problem or am I part of the solution? So these statistics came from 2015, the year that my son died. Drug overdose was the leading cause of accidental death, more so than motor vehicle accidents. In Louisiana at that point in time, it was even higher than Ohio, where there were 888.7 opioid prescriptions per 1,000 residents. That's huge. So I'm going to back up and tell you, my son, after he admitted that he had become addicted to OxyContin, we got him into a rehab. And at that point in time in 2015, rehab consisted of 2 weeks of inpatient, followed by some follow-up outpatient. And that was it. You were a one and done. So he learned while he was in rehab that OxyContin is synthetic heroin. And if you learn much about addiction, you will find out that most people who are addicted to anything, when they try to get clean, most do not succeed in their first attempt. Most will relapse, and it takes a few tries. Some never make it. And they kind of call it the addiction waltz. In a waltz, you do 1, 2, 3, 1, 2, 3. Well, when you have addiction and you go to meetings, whether it be for Alcoholics Anonymous or Narcotics Anonymous, there are steps that you work. And depending on where you are in your recovery process, the steps are numbered. And most people get 1 through 3 and then fall back to 1. So he became addicted to heroin not long after getting out of rehab. And, he would get better, he would get worse. And if you've been around many people who are addicted, some of the symptoms of addiction are lying, stealing, and they become someone that's really hard to be around. And, as a parent, here's the person that you love more than anybody in the world. And you hardly recognize them, and you have to start protecting yourself from them. And it goes against all of your motherly instinct, but you have to make that choice. Am I helping him, or am I helping him hurt himself? Sometimes your helping is actually enabling. So I had to ask him to leave my home, and he moved to Georgia, where he moved in with a friend who I later found out was also addicted to opioids. While down there, he would get better, and he went through a program down there, and I really think at the time it saved his life. But then he relapsed, and finally his father brought him back to Ohio. And when someone was right on top of him and watching him all the time and making sure he stayed straight, and it's almost a full-time job, he did better. He pulled through. He went to OSU and finished his degree. He was doing very well. He was going to Narcotics Anonymous classes almost daily. And he went to an NA outing where they went whitewater rafting. Well, his raft turned over and he got his ankle caught, and he tried to break free and managed to break free, but in the process, he tore some tendons in his ankle and he had to go in for surgery. Despite the surgeon being told by my son and by his father that he was a recovering addict, he was given opioids during surgery and prescribed opioids afterwards. So the addiction started all over again. You know, it finally got worse. So I'll tell you the rest of the story as we go on. But he finally got to the point where he moved in with a girlfriend, and we thought maybe he's getting better, but then she became addicted. And he decided finally that he had had enough, and he really, really wanted to get better. He had been really working on being clean, and I think he had been clean for the most part. He got a job. He was passing drug tests. And I had told him that he could move back home with me because the relationship with a girlfriend was a very toxic one. By both their faults. So he moved his things in with me, and it was during the Ohio Dental Association annual session. And, you know, that whole weekend, it was a busy weekend, and moved some of his stuff in, and it was a Sunday. And I said, gosh, you know, let's just do something tonight, you and I. And it goes, Mom, you know, I'm breaking up with her. I'm going to go back for one night, just one night. And then starting tomorrow, it's a whole new life for me. And, you know, this will be great. We'll do this together. Well, at 4 a.m, the police woke me up, knocking on my door, informing me that my son had died of an opioid overdose. And, you know, you as a parent, you kind of prepare yourself that something like that could happen. Although it's, you know, the worst news in the world. And I waited until about 6 or so to call my mother. I didn't want to wake her up with that news. She quickly got ready and she came over to be with me. And 2 hours after she got here, she collapsed in my kitchen and died. They think that she had a heart attack caused by stress. But, you know, you never know what happened, what being addicted can do to the person's family. It isn't just the person addicted. It involves a whole lot more. So after my son had died, an oral surgeon that I was friends with, and we worked together a lot at the ODA, came up to me and he goes, oh my God, Sharon, I didn't know. I didn't hear that your son had died. I feel terrible. I wasn't there for you. He goes, my God, what can I do? And before I even thought about it, what popped out of my mouth was, you can prescribe fewer opioids. And he kind of got a look on his face. He says, oh yeah, okay, and walked away. And I thought, well, I didn't think any more about it. Well, a couple months later, we were at another meeting together, and he said to me, hey, I got to talk to you. He said, I took what you said to heart, and I went back and I looked at my prescribing practices, and I thought, okay, because I was dreading it, but I did it. He goes, because I had promised you I was going to do this. He said, I thought I was going to spend every weekend fielding calls, people in pain, and it was going to be hell. And he said, you know what? No one called. It's been amazing. So one thing led to another, and we started kind of speaking together. We were asked to speak at a meeting, and he shared with me what in 2015 their normal prescriptions were for wisdom tooth extractions, for other extractions, and I'm going to share those with you, and that's what this is. So someone would come in and for a tooth extraction, and it was mainly for wisdom teeth, and they would get 20 Percocets. So if in that year, in that age group, there were in his office, but the number of wisdom teeth cases, they handed out 20,550 Percocet or Vicodin tablets. That was just wisdom teeth. Any other adult procedures done in the office, extractions, implants, biopsies, there were 21,000 700 Percocet or Vicodin tablets. That makes 42,250 class 2 narcotic tablets handed out by one office. So we extrapolated this, and I'm going to give you Ohio because that's where I live. If there are 300 oral maxillofacial surgeons in Ohio, 200 practice, and if they all prescribed like this, that makes 8,450,000 class 2 narcotic tablets. Well, the oral surgeons are not the only ones who prescribed. So let's look at all the dentists. And we'll leave out, we've already talked about oral maxillofacial surgeons. Let's leave out pedo and ortho. That leaves 6,000. And if the rest prescribed at, say, 10% of that level, that still gives you over 25 million class 2 narcotic tablets. So why do we prescribe? Well, the goal of post-op pain medication is to minimize pain and anxiety. Can we make this better? What's the goal? We want to decrease nociception. You can block it with a long-acting local. You can decrease the inflammation with an NSAID and use acetaminophen to its fullest potential. I don't know if you have heard of Exparel. Some people are using that. That's a long-acting local. It's a local anesthetic, but it's not given to get the person numb. It's given afterwards, and it's only it's given as a buccal infiltration. Some people are using the photobiomodulation part in their soft tissue laser to decrease some pain. I have no facts on that. That's just strictly people telling me this. So I can't say one way or another whether that works or not. So you also want to educate the patient and the family, and only use a narcotic as a rescue medication. Try, most people have been doing the maximum amount of Tylenol and then the maximum amount of Advil. Tylenol, Advil, back to back, back to back. Don't let one wear off before you start the other. So for his office, what happened when he changed his practice was that he rarely has any requests for refills. And if he gives, anything, it would be just a couple tablets, maybe 4 at the most. Fewer calls for pain and insomnia. Nausea calls are almost non-existent, and the parents are thrilled. And I'm going to go through these really quickly because I'm in Ohio and everyone can be in a different state and everyone's laws are different. Most states now have limits on prescribing opioids. So you need to make sure, if you're a dentist, make sure that you know what the laws are in your state. If you are an assistant hygienist, you may want to help the doctor make sure that they understand what the laws are. And these, again, are just some of the things that we have in Ohio. In Ohio, you base the amount that you're allowed to give on a morphine equivalent dose. So there are a lot of places that you can find out how to figure out a morphine equivalent dose. So, just make sure you understand all that. ORS, we have in Ohio, it's where you go online and you check to see what the patient has already been prescribed. And a lot of times you are required then to report what you are prescribing for a patient if it's a narcotic. I'm just going through these very quickly. So in Ohio, we have to have a CDT code if you prescribe a narcotic. So that may be the same in your state as well. I would make sure you know about that as well. I live in one of the states with a really high We were one of the states hard hit by the opioid epidemic. So, the ORS took over, they mandated it early on, but it has worked well. And, it's really easy now to find a drug seeker. We would get calls for people drug seeking all the time before, but once ORS went into effect, I rarely get those calls. In Ohio, any prescriber can register with ORS. The only people that have to register are people who, if you are prescribing an opioid or a benzodiazepine, or that you are furnishing them from your office. You also can have someone in Ohio, you can have another person registered in your office that can do this work for you. Let me get through these. All right. So when I was talking about before, my son and the way he acted and the way it was obvious that something was wrong, but I couldn't quite put my finger on it. I had another thing happen in my office after that. And I had a patient, a longtime patient. And she's about my age. And she came in and she said, Sharon, I wonder if you would see my daughter. She lives out of state. She had been addicted to, I think it was meth. But she's gone through rehab, she's fine now, and she broke a front tooth. And could you please see her? So I said, sure. She came in and she'd had a crown on number 7 and the tooth had broken off at the gum line inside the crown. So, sent her for endo and do, post a new crown because she's had plenty of tooth left and she was a relatively young girl in her early 20s. But after, the endo and we got the temporary, she kept breaking everything. She broke every temporary I made, even though I tried to make it so that she barely hit it. She broke any post I put in. She broke the tooth down more. I mean, it finally got to the point where she had to lose the tooth. And I kept looking at this thinking, something is not right. So I did some reading up on meth. And as it turns out, one of the symptoms of meth use is extreme tooth grinding. Oh, God. So I called her mother, and what I'm going to tell you is I broke HIPAA, and I don't know that I would, recommend doing this, but I made that choice personally. And I told her mother that, the tooth was going to need to come out, and I said, I just don't. I said, besides that, I don't think your daughter is clean. I think she might be using drugs again. And the patient got really mad at me and she hung up. And I thought, well, all right, Sharon, you screwed up. You're going to probably lose a patient, but I did what I felt I had to do. And a couple of weeks later, she called and asked to speak with me. And I came to the phone and she said, I want to apologize to you. She said, I was really angry with you when you told me that. And she said, but what I was really angry about was the possibility that that could be true. She said, but I started looking at it and she said, you were right. You were absolutely right. She was not clean. And we got her back into rehab and she's really working on things now. She said, I called to thank you because you might very well have saved her life. So sometimes you need to know some of the signs and the symptoms of certain drugs. And I'm going to go through these with you. And I'll try not to take too much time because I know some of this is not, real exciting, but you may be able to help save someone's life too. So I'm going to start with opioids because that's what Sean was addicted to. Slurred speech, poor memory, Coordination can be off just a little. The pupils, they can be dilated or constricted. So, it gets a little tricky. One thing that always happens is the constipation. Sleep patterns are off. They have trouble sleeping at night. They're up in the middle of the night. With long-term use, they can get hostile, angry, aggressive. They tend to withdraw from social things. And again, tooth grinding and higher decay rates. Heroin is going to be the same as opioids. You're going to see needle marks. Won't always be on their arm. They can put it in other places. Because of needle use, they're going to have a greater chance of hepatitis and AIDS. Cocaine and upper. You're going to have dilated pupils. They're going to be excited. They're going to talk. They're going to be euphoric. They're going to have abnormal sleep patterns. They're going to stay up for a long time. Decreased appetite, increased heart rate, which is going to be really important in your chair. Runny nose, nosebleeds. They may have burned lips. They may have little burns on their fingers, mouth sores, grinding, increased decay rate, especially on the buccal, transient chorea, buccolingual dyskinesia sometimes. Meth, no sleep for long periods, a decreased appetite. They're going to lose a lot of weight. They're going to look gaunt. They're often anxious, confused. Their pupils will be dilated. They might be sweaty. They're going to have often an increase in their blood pressure. So, it's very important that you're taking blood pressures in your office. Skin sores, they will pick at their face a lot. And the meth use over time can cause blood vessels to shrivel and die. They're going to have a dry mouth. They're going to be grinding a lot. They're going to have high decay rate, meth mouth, a lot of decay on the buccal. Bath salts. And, there are not that many people who use those, but they're pretty extreme. And as a fact, one of my friends from high school, his daughter was killed by someone who was taking bath salts. It's an extreme stimulant. They're going to have increased blood pressure, heart rate, and body temperature. They can have chest pains, kidney pains, muscle tension, nausea. They get very confused, very paranoid. And this is what happened, and delusional. This is what happened with this man who killed my friend's daughter. They get agitated easily. They get very violent, and sometimes they have unnatural strength. I think you've probably seen some things on TV about, the police trying to stop someone, and, there might be 4 policemen, and this person just throws all of them off, probably on bath salts. Club drugs, big in high school, college, early 20s. Stimulants that often look like colored candies. They're going to have an irregular sleeping schedule, a lack of awareness of pain, increased sexual activity. They're always falling in love, dry mouth, grinding, anxious, depressed, confused, and long-term use can cause brain damage. Marijuana, bloodshot eyes, kind of lethargic, might be very talkative, memory problems, dry mouth because of the smoke. If they're smoking it, an increased chance of oral and throat cancer, increased chance of perio disease, and they may have enamel erosion from cannabinoid vomiting. Alcohol, dilated blood vessels. You're going to smell it on their breath. They may build plaque faster. They may get tooth decay from acid. Adderall, which is big with college and high school students. Headache, restlessness, fatigue, nausea, dry mouth, hoarseness. With long-term abuse, you can get numbness in your limbs, dizziness, hives, peeling skin, chest pain, and even seizures. So why do you speak up? Well, like the story I told you. Often, adolescents, people in college, people in the early 20s, they may see the dentist a lot more than they see a physician. And often, the parents are in denial. They don't want to know about it. The parent may resent the implication, like I told you. But, are you going to risk losing a patient or really losing a patient? In your area, you're going to have a lot of different resources. So, look those up. Okay. So, do we have any questions, Kay?
We don't have any questions yet, but please make sure, guys, if you want, I see someone is raising your hand. Julie, what I need you to do is just put your questions in the Q&A, and then we will be able to answer them. So if you will just type your questions in the Q&A, we'll be able to answer them.
And, don't be shy. I've been asked lots of things, and I obviously, from everything I've told you, you're generally very open. So, anything that you would like to know.
So I'm curious. So when you called the mother and you had to address it, that had to be probably one of the hardest decisions that you had to make as a doctor.
It was horrible. And, I really fought with myself. The logical part of me said, don't do that. And, it's none of your business. But the mom side of me, especially after losing a child, I just felt like I had to say something, because if it had been my child, I would have wanted someone to say something and to help me try to save them. And so yeah, it was really tough.
I'm just curious. So let's just say that this happens in an office. Is there somewhere that is there like a 1-800 line that they can refer their patients to? Should you address that with the patient chair side? I'm just curious your thoughts on that.
Well, I think that you can talk to the patient about it. You can ask about it. There's going to be resources in every area. In our area, any mental health addiction services will be able to help. If you want some overall resources, I do have a nonprofit called A Voice for Sean, and it's just for the purpose of preventing opioid addiction. So on it, I have lots of resources that people and bullet points and facts that people can grab. You don't have to pay for it. You just go to the site and you can get information. So
and what we can do is, if you can share that with us, what I'll do is I'll get Alyssa to send that out when she sends out the Q&A, and we can go from there. If you want to open up your Q&A, you now have 8 questions. So Alyssa, you want to go ahead and take over the back screen, and we'll let you open it up. Doctor, just push on the Q&A. And the very first question you'll see is from Robert, and he wants to know more about the bath salt.
Boy, I don't know much about that. I know there is something called bath salts, but how they actually use it, I don't know. And it's not, it's not something that you use, when you take a bath. That's just, the name of it. But that's the one that I am the least familiar with, is how the drug is actually used. But it's very potent and just a nasty kind of a thing.
So, and Matt, I see you have your hand up. If you will just go ahead and put your question in the Q&A, that's the way we can respond to you the best. So just type your question in. So do you want to answer the second one?
Sure. Let's see. Ibuprofen with high blood pressure meds, contraindicated. What would I use? I would find out what they're able to take. Tylenol. And I know, that sounds kind of lame. But depending on what you do, when I had a C-section, I came home from that, and I really took nothing but Tylenol. So, sometimes it will do the trick. You may want to look into something like an Exparel. If you do a lot of procedures, and you run into this and you don't want to prescribe opioids, then you may want to look into something like that. The Exparel can last up to 48 hours. And it is a local anesthetic that you inject into the buccal mucosa around the area that you've worked on after the procedure has been done.
Fantastic.
So if you suspect addiction for minor.
You can read it out loud so everyone can hear
Yes, it could be, if they're not a minor, if you suspect addiction for a minor and you raise this to their parents, is that considered violating HIPAA? No, not if they're a minor, at least not in Ohio. How about with spouses? When you get into an adult, then anything you say to anyone other than that patient can be a violation of HIPAA. What I did would have violated HIPAA. So like I said, I can't recommend that people do that. That was just a value judgment on my part. If we suspect, should we be talking to the patient before talking to the parent? Yes, I think so. Unless it is, I've had a couple of patients who, they were just very sullen, and, you try to talk to them and, they do that teenage thing where they won't talk to you. Well, then it's almost impossible. But if it's a patient that you've had a relationship with, you feel good about, I would try to talk to the patient. I would, hey, I noticed that, things are not quite the same. Something seems to be a little off with you. Is it possible that you could be, doing this or using that? And if you could connect with the patient and they would react, on their part, that would be even better, because sometimes they'll react better to someone else than their parent. So what's the best over-the-counter medication combination you would recommend for the first 24 to 48 hours? Like I said, Tylenol and ibuprofen back to back, the maximum of each. And don't let one wear off before you start taking the next one. What is the treatment of opioid addiction except for rehab? Well, some patients can, take things like methadone. My son and a lot of other people addicted, and it still is, you're addicted to that then. So it can help. And you're not taking the opioid is certainly better than heroin or OxyContin. The goal is to not be addicted to anything. And it's tough. Right now I'm a member of Rotary, and I'm trying to see if I can't get the Rotary to embrace addiction and opioids like they embraced, and I'm having a senior moment, polio. They helped eradicate polio. So, what about if we could find a cure for addiction? I mean, people can treat bipolar disease, people can treat depression. Who's to say that we can't find something that will help with addiction? Because it's such a horrible disease, and not that all diseases aren't horrible, but they suffer so much and they feel so horrible about themselves. My son thought he was just lower than, snake crap, and felt horrible about himself and embarrassed, very embarrassed, because there's such a stigma. Do I think kids playing intense sports at the critical ages was a factor in kids getting addicted? Absolutely. There have been a lot of young athletes that have been addicted because they were put on narcotics because when they got hurt, they torn ACL, any other kind of a thing. Someone I work with here in town, his son died of an opioid overdose and was a football player in college. So absolutely. And thank you for sharing your story and experience with us. Well, you're very welcome. For me, I learn better when I know why I should do something or what would be the reason, instead of someone just telling me that that's what I should do. So I'm hoping that by sharing my story, you'll kind of put a face with the idea, the face of addiction. My son doesn't look like the person under the bridge. He could be anybody's son. It could happen to any of us. And I don't think there's many of us who don't know somebody and haven't been affected somehow by addiction or someone dying. And I think, it takes all of us working together to help this. Right now, as of May, and I know it's gotten worse because there have been an increase in opioid deaths during COVID. In May, every day in the United States, 128 people died of opioid overdoses. That's on average. Some days it was a lot higher. And to put that in perspective, on a Boeing 727, you can fit 106 people. So in essence, every day in our country, a plane goes down with no survivors. And it's happening, and it's been happening since 2015. So we really need to find a way to do something about it, and we need to make sure that we're not part of the problem.
So on this one, for the one that they shared, someone actually shared a site with us, and what I'll do is I will get Alyssa to include that in the Q&A. So thanks, Ruth. I really appreciate you sharing that site about the abuse of the bath salt. So we'll share that with everyone when we see out the Q&A. So why don't you go on to Christine?
Okay. Christine had to deal with a teenager, called the mom. The mom became very defensive and left the practice. At an ethics class that I later attended, the moderator told me that revealing my concerns to mom was a violation of the teenage patient's privacy. She was a minor, but that didn't matter to the ethics leader. He said not to do it. Like I said before, I think it has to be a judgment call. I would disagree with that person. Of course, I have a different perspective. I lost a son. And there is nothing, absolutely nothing worse in life than losing a child. So I would respectfully disagree with the person, but that has to be a judgment call on your part. And every person is different. And like I said, I thought that I lost a patient, and the patient's mom hung up on me. But it may not always go that way. But you have to do sometimes what your conscience tells you to do. Oh, so as a sidelight, I would like to say that your neighbor to the west, Indiana, was #1 in 2015, #1 in meth production, that is. Yeah. Right now, opioids are down, but meth is up again. Cocaine is up again. Fentanyl is, as you know, huge. So how do we control the meds moving forward? Well, what you mean by we, if it's dentists, then, we have to be careful about what we prescribe. There also are drug disposal bags. So if you find it necessary to prescribe, and sometimes, nothing else is going to take it away. I wish we had something else better for pain. And that's another thing I'm working on the Rotary, or, somebody to do some research on. But they make drug disposal bags as well. And it's a bag, and it has, I think, activated charcoal and something in it. Anything that's not used, It's thrown in this bag with a little bit of water, crunch it up. It can be thrown in the trash. It's neutralized. But we have to not prescribe as much, and we just have to keep getting the word out. Yes, meth can't be prescribed, but you can save their teeth from a horrible fate if you recognize the situation and start them on the right path. Absolutely. I agree wholeheartedly. And thank you for doing that. Are current dental students taught to choose opioid therapy as the last treatment option? I only know about, I go speak to the students at Ohio State and Case. I hope that they're being taught about addiction, because I think once you understand addiction, you understand why the opioid therapy should be the last treatment. But yes, I know in Ohio they are being taught that, but I don't know about other schools. And Matthew said thank you, and you're very welcome, Matthew. Anne, one of my best friends, tells me my son would be proud. So thank you, Anne. Yes, and Exparel is the same as bupivacaine, and as a side note, it's difficult to buy and expensive. Yes, it is. You're absolutely right, Jose. There are, I know of there are 2 insurance companies that do cover the Exparel. So I hope that someday that will come down. Anne wants to know if I can talk about the man who sold the drugs to my son. Yes, he was an addict himself, but I did pursue this, and it took a while, but the police did arrest him, and it was fentanyl that killed my son. And I'll never know if he knew what that's what they found in his system when they did the autopsy. Did he know what he took? I don't know. I do know that the day before my son died, another person died that he sold it to. So he knew that people were dying, and he sold it to him anyway. So he is in prison for 10 years. So I'm hoping that I saved some lives by making it so that he couldn't sell to anybody else. Should we be more open to prescribing a mental dose pack to control pain? A lot of people do that, and the oral surgeon that I speak with does do that sometimes. So I think that sometimes that might be the answer. Go over pain recommendations again. Can you combine Motrin and Tylenol together? They're working on that. They've always said to take one and then the other. However, someone, and I don't know what company it is coming out with one pill that has the best amount of both in that one pill. And it's not out yet, but I'm hoping it will be on the market soon.
Fantastic. Well, I want to say thank you so much for taking the time to answer all those questions. And, it's funny, we were talking before this started, and, we've both lost our sons. So I lost my son five years before Dr. Parsons. And so when you have 2 mothers here on this same webinar who've lost their sons, we both, in your heart, every single question that you answered from a mother's perspective. And I totally respect that. So I know where you're coming from, and you did an amazing job. All I'm going to say is to the people that are out there that are listening, that are prescribing, please make sure you watch that. And I will say this too, doctor, that I've also seen it where it was also abused by the team. So I think you have to watch it all the way around. Have you seen it where it comes across where sometimes the team members can also be misusing the medication?
Yes, absolutely. Absolutely. And, I think that's a reason not to keep anything like that in your office.
So anyway, so thank you very, very much. We really appreciate all of your questions, and you did an amazing job. And I know your son is very proud of you. So thank you for that. So with that being said, guys, I want to say thank you to Doctor. And I also want to tell you a little bit about what's coming up. So Alyssa, do you want to change the slide? So if you will just scan this QR code, will be able to see the webinars that are going to be coming up for next year. All you have to do is scan the code. It'll take you to the website and it'll show you. We are in the process of planning right now. So when you fill your paperwork out, please make sure, we really want to know what you want to hear. So please let us know and give us some feedback. And then with that being said, I also want to tell you about an upcoming workshop. So Dr. LaPaul is going to be doing a workshop. Now it's a 2-hour workshop. So if your team is really wanting to kind of get together and know more about, the new guidelines for infection control and what you can do in an office to make sure that you're doing everything correct, this is going to be the workshop that you want your team to take. So again, it's going to be on January the 29th. The seats are limited. It's going to be from 1 to 3 Eastern time. And all you can do is take a picture of this. You go to benco.shop. I'm sorry, you go to shop.benco.com. Again, that was shop.benco.com, and you will be able to register for this workshop. It's really going to be a fantastic workshop, so you're not going to want to miss out on that. And then with that being said, I also want to let you know, this is our final webinar for 2020. So we look forward in resuming our complimentary webinars in January, and hope that you continue to join us and stay tuned for more information. And I saw that 2 people on the webinar did use their cell phones to dial in. So this is what I need you to do. If you need CEs, please make sure you email me your name, the title of the course, and your cell phone number to practicecoaching@benco.com, and we will make sure that we cross-reference that so that you will receive your CEs. I hope everyone who's watched me do all of these webinars since March, everybody has a fantastic holiday season, and please be safe, and we will see you in January. Thank you so much. Bye-bye.
Bye.